I'm Suha and I'm doing the MSc in Health Psychology. Health psychology is looking at the aspects of diseases and illnesses and the psychological, social and biological factors that are involved in that. I was attracted to this discipline because I find that oftentimes in science there's this kind of Cartesian dualism of like mind or body, but health psychology is kind of both of them. It's saying that yes, you can be ill, but how does that affect the way you behave and the way others behave around you and your place in society?
Well, I'm really interested in sports. I studied psychology in Spain, the bachelor's degree. So I was really interested in how health behavior affect physical, mental health, how they merge, how also sports and diet and those type of health behaviors work together, and which are the attitudes of people towards those type of behaviors. So I was trying to get a more in-depth understanding of everything related to health, psychology and well-being.
I really liked the chance that we got to shadow a person in an actual health setting. So I got to shadow a nurse at a rheumatology ward at UCLH. And that was really interesting to see how she not only had to be an expert in her field, but she also needed to know how to communicate with people and get the best out of them and make them understand why it's important to keep to their medication and keep coming back.
Well, I think one of the main things of this course is that you get both a sense of research and clinical practice, because you have the opportunity of going for placements throughout all the year. You've been offered placements, as well as you've been lectured by top researchers in the field, and then you have the opportunity to do a dissertation at the end of the course, which gives you a bit of background of both research and clinical. So I think that's the main thing of the course. You can get both things.
My name is Holly and I'm currently studying an MSc in Health Psychology as part of an Economic and Social Research Council funded 1+3 PhD. My PhD is part of a large dementia intervention which is called Promoting Independence in Dementia, and my PhD will be focusing on evaluating the implementation, so how well the intervention is delivered as intended and whether I can improve that to be more accurately delivered.
I really like the fact that UCL has this global approach to education. I mean, it really promotes the idea of diversity in its students, and London's a perfect example of that as well. I love walking down the street and hearing like different languages and different people from all around the world.
I'm hoping to become an academic, so I'd like to lecture and do research. And then possibly in the future I might go on to work in practice and things like that, so I might do chartership, but I'm not sure yet.